Thanks so much for staying with us. It's time now to answer some common medical questions. And joining us to help us out is News Channel 5's medical specialist, Dr. David Soria. He is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for stopping by.
You're welcome. Good to see you.
Good to see you. Our first question this afternoon for you is pretty common. Can a rash occur when you get or feel nervous?
You bet it can, and it actually is pretty common. A lot of people didn't know that, but it is, because it can vary from being very subtle to quite severe. And really what it is, it's your fight or flight response. You get nervous, all of a sudden you start to feel that anxiety. And in many people, that can be a rapid heart rate or even some sweating. But in some, it's the vasodilatation or the opening up of vessels, and it develops into a rash.
On the neck.
Classically in the neck, the chest, the face. Can even happen in the ears or in the upper extremities. And, you know, it's pretty mild, goes away in about 15 minutes once you remove yourself from that stress. But if it's severe or persistent, there are medications like a beta blocker or even antihistamine that can treat it.
Okay, so if it bothers you,
if it happens regularly, absolutely get it checked, and there is some medicine that will treat it.
Okay, all right, good stuff. Our next question for you today deals with an issue so many people face here in South Florida. How often should you really be checked for skin cancer?
Oh, yeah, it's a very good question and an important one, because skin cancer is, what people don't realize, the most common cancer that's diagnosed yearly. 3 to 4 million patients get diagnosed with it every year, and 1 in 5 of us will have it through our lifetime. So very important. Don't want to blow it off. Typically, your doctor will check it every year on your physical exam, but I would not rely on him or her to do that. Know your skin, or own it. It's your skin. Know it. And the way I try to tell my patients is, look every quarter at your own skin. Take a mirror, look at the back of your legs, soles of your feet, right? Webs in between your toes and fingers, very common areas where skin cancer can creep up and not be diagnosed. Don't look at it every day. Don't look at it every week, because you won't see those subtle changes. Once every 3 to 4 months is all you know. And you know what? In today's day and age, take a picture of it. What I like to say is, take a skin album. Sounds corny, but it can save your life if you see those subtle changes accrue or develop over 6 to 12 months.
Or ask your doctor, right? Hey, doc, can you check me? You know, you're here at the physical. Will you check me for skin cancer?
Of course,
if they don't?
You bet, because it's not necessarily part of the routine exam.
Right.
So know your skin. It's yours. You should be responsible for it, really.
Okay. All right. And our third and final question for you is for those who enjoy exercising. So the question is, after working out, I have a slight pain in my ankle when I walk. Is this an Achilles problem?
Well, it certainly can be. I mean, ankle pain is one of the most common joints where you develop pain, because it is a major weight-bearing joint. First, though, I want you to make sure it's not anything more serious, like an arthritic problem like gout or rheumatoid, or that you may have a stress fracture, especially since what I'm hearing is that it's presenting after your workout. Now, there's 3 major tendons that most commonly will develop a tendonitis with overuse or exertion. The Achilles is one of them, and probably the major one. And that's typically how it presents, like it did in our viewer. After working out or exertion, you feel pain, and it hurts when you move it, and after you rest, it tends to go away. Minor will go away quickly in a few days. More severe or chronic ones can last weeks to months. Don't expect it to go away quickly. You need to rest it. Take an anti-inflammatory like an ibuprofen or an Anaprox, anything like that. Immobilize it, rest it, and take its time. It's going to take some time. Be patient, and it'll go away.
All right. Good stuff. All right. Dr. David Soria, thank you.
You're welcome.
And if you have a question for Dr. Soria, you can always send it in by clicking over to WPTV.com and then click the health link. Scroll down, and on the right-hand side, you'll see a form to send us your question. Thanks for coming in. We'll see you next week, and we'll see you right after the break. Stay with us.